Welcome to a special edition of Medical News Network, your trusted source for the latest advancements in the medical and dental field making your life better. I'm Mike Wittgenstein, and thanks for joining us. Today we brought our cameras to Norman, Oklahoma, to the offices of Dr. Robert Talley, an internationally recognized leader in the treatment of TMD, or temporomandibular joint disorder, now known to cause migraines, headaches, back pain, neck pain, and a variety of other medical conditions, and recently linked to Parkinson's, Alzheimer's, and maybe ADHD. And sleep apnea, or stopping breathing while you're sleeping, which can cause hypertension, heart conditions, and a variety of other things, sometimes even an early death. So if you toss and turn at night, you snore, you have headaches, migraines, or maybe you just have a condition that no doctor's been able to explain to you why you have it, my advice, sit back, relax, get comfortable, because you're about to learn some very valuable information. We'll be right back.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. We're with Dr. Robert Talley of Norman, Oklahoma, learning about TMD and sleep apnea. Doc, first I want to say thank you for allowing me to bring my camera and my crew out today and taking the time to educate us a little bit. I did ask you to have a few patients out. Obviously, you had quite a few show up. Everybody here has been treated by Dr. Talley? Everybody here has been treated successfully by Dr. Talley, I take it. Let's start then with sleep apnea. What is it? Give me a little idea of what it causes. I know you've got an image up here. Just kind of fill me in. What is sleep apnea? What are the causes and concerns of it?
Mike, sleep apnea is when a person's breath stops. They stop breathing during the sleep. As they're sleeping, the airway is blocked typically by the tongue and the back walls and side walls of the throat. It's called obstructive sleep apnea. It's the most common type of the two types of sleep apnea. There's also a central apnea, which is the brain forgets to tell the rib cage to work to bring air into the lungs. But in normal sleep apnea, which is an abnormal condition, but in that apnea, the lungs are continuing to try to expand, the chest wall is working, but the throat is blocked off so that the air can't get to the lungs. Creates stress on the cardiovascular system, creates tremendous loss of oxygen in the blood, so that as that oxygen level drops, the CO2 level goes up, carbon dioxide increases, the heart begins to pump harder, it works hard, it creates tremendous cardiac stress. It breaks down the organs, causes cloudy thinking, it causes people to be forgetful, it causes people to have excessive daytime sleepiness. It's a very common problem in the sense that it leads to so many other problems that people don't associate with the poor sleep. But it fragments your sleep, and therefore you don't sleep well and don't stay well.
So is snoring? I mean, if I snore, does that mean I have sleep apnea?
No, not necessarily. You can have snoring that stands alone. It's called primary snoring, and it's associated, though, with the beginnings of airway restrictions. In other words, there's vibrations in the oropharyngeal structures, which is the mouth and airway, where the nose and mouth come together to go down into the pharynx and down to your lungs. That vibration causes the noise, but the noise may not cause the airway to be completely blocked off. But snoring is kind of the tip of the iceberg. It's the beginning of something breaking down in the airway, and it almost always eventually leads to sleep apnea if you continue to have it long enough.
What age does it usually start to affect people at?
Well, it has been thought in the past that sleep apnea was principally related to men, older men, typically over 45 to 50, and typically overweight, but that's been proven to not be true. Though that group of people definitely has the risk, especially large athletes, some of the really heavy people, but thin people like me, others, women, children, it can affect children at the age of 2 or 3. So it does affect every age. Elderly people have it. It's a significant killer of people. It's the #1 reason why people don't wake up in the middle of the night. People that die in the middle of the night, if you think about it, if you're sound asleep and resting, why would you die? You shouldn't have a heart attack or a stroke during the middle of the night unless something stressful, and the cardiac stress from sleep apnea is one that causes that.
The reason I want to talk to you about sleep apnea is it's my understanding, and so far nobody's disagreed with me, that if I go to a medical doctor and go to a sleep study, I'm going to get one of these. I have friends that have these that don't wear them. They would almost, I guess, rather die. I don't know. I mean, it's so like sexy, and I mean, it's got to be you roll over at night, hey honey, I got the... But this is what they get, is it not?
Yes. You get a CPAP machine. That's the mask that fits on your face, and then there's a machine that it attaches to, like a little vacuum cleaner, and it blows air down through your nose, down your throat, opens the airway, blows your tongue out of the way. They're called a pneumatic stent. They just blow the airway open. It's kind of like the wind sock at an airport. When the wind's really blowing, it's filled out. When the wind's not, or if something's in your throat sucks it down, the sock falls down and collapses. So those things blow it open. They're really comfortable and problematic to most people. So most people that are not going to wear these very well. The statistics prove that. There are varying statistics depending on who you look to as to how many people will stay with them. But most people, the vast majority of people, do not stay with them very long because they can't stand to wear them. They're annoying, interfering with everything. They have some medical problems, irritation to the eyes, nose, throat, mouth gets dry. Some people can't have to use a full mask like this is instead of little ones that fit just on the nose, and they're very cumbersome. So in dentistry, we offer, those people trained in dentistry and dental sleep medicine, offer alternatives to CPAP machines to open the airway by using an oral device, which is an oral appliance, like a splint or a device. We have several kinds right here that we use to open that airway up, and they help us to create a bigger airway. As an example, in this particular picture right here, this is a very narrow airway. This white shadow through here is the airway up into the sinuses and nose, which would be up here, chin down here. But this airway in this area right here, which this line would outline the airway against the tongue. So this is the base or back of your tongue, that line right there. This is the back of your throat, and it's very narrow. And when we use an oral appliance and have a healthy airway, we see how dramatically different this is in the shape and size of an airway when one has a normal airway that we expect to have when we use one of these devices. They're frequently referred to as oral dilators, and they are devices that may have 2 or 3 parts to them. They fit together. You bite into this little device. It rests between the teeth. It holds your jaw in a specific place. This is one particular type that we use. This is another one that's quite commonly used, developed in Australia originally, and it has 2 parts. They come apart, and you can open and close like the first one. You can talk with them in your mouth. You could actually drink water or take a pill or something. Then we have the type that are attached to each other. These are just examples of them. These have little hinging type devices on them, and they attach to one another, top and bottom, and you put this in your mouth and bite into it, and it holds your jaw in a particular position. You can still move around. There's another type here that has a pin in the front, and there's 2 or 3 types like this. They're very stable and work extremely well, and they look like a dental splint, a protector for the teeth, except there's 2 of them, they latch together. So there's multiple types. There's over 60 FDA-approved types of devices that are used as oral airway management tools, called oral appliances for sleep. And they dilate or hold open the airway.
So are a lot of the causes of, and I don't know how to put this, but because we are going to speak about TMJ here in a moment, and sleep, are they somewhat related sometimes?
Very commonly. In my practice, I find that about 80% of the people that have sleep problems that they come in for also have something wrong with the mechanics of their jaw, which is a TMJ problem, referring to the temporomandibular joint, the jaw joint on each side of our face. And likewise, about 80% of the patients who come in here because they have a jaw problem and headaches and facial pain problems also have sleep disturbances. And it is often considered the cart and horse and egg and chicken rule as to which one came first that led to the other one, or they could occur at the same time, which in medicine is called a comorbidity, which means commonly occurring separate entities of problems. And so this type of issue is very common. We see it just, all the time.
You told me that that is the only joint on our body that dislocates every time we open or move it or use it or breathe or swallow, and then goes back in. So take a moment, and if you would, I think you have a slide up here, explain to us how that joint, what it looks like and how it works.
And this is a cross-section, kind of hard to get your bearings on this, but this is a cut through somebody's joint. It would be like looking at, Mike, your right side joint.
Right.
This would be the ear hole.
So that's the ear.
This would be a little styloid process, a lot of muscles and ligaments attached. Right. It's underneath and back behind your jaw. This is the ball portion of the lower jaw coming up, and it's covered with
so is it right in front of my ear?
It's
if
right
I put my fingers right there and open and close.
And then open and close, you'll see and feel this little ball.
I can feel it going
This is your cheekbone. So as we look at this, we take some away. There's ligaments that are parts of that capsule, and you take more away, and we're just looking like we're doing a dissection, so to speak, through this. This is ligaments and blood vessels and nerve endings, and